Jaakko, I was surprised when you told the conference that open dialogue is not a technique for psychotherapy, but it's a system of treatment. And I'm hoping you can explain a little bit about what that means.
Yeah, it has a background in the process that we have been living in Western Lapland, in which this idea open dialogue system was generated. First, when we worked by those ideas of having open meetings in which the patient comes from the very beginning, and open meetings in the way that families are always invited into the meetings without any need to think that those are family therapy. We were working on those ideas some 10 years, and then we after one research project in which we analyzed that what are the illustrative factors of this new type of treatment. I have to add one thing. In this new type of treatment, since late 80s, we started to realize that we have to have the first meetings with families immediately, and for that reason the system was reorganized in the way that there is a crisis intervention teams available for the population within 24 hours in any kind of crisis. And after having that kind of experience of some years, we came into an analyze what happened with the patients who became for the treatment because of psychosis during 2 years period of treatment. And this analysis was done by analyzing the patient records, what is reported of the treatment, and made a comparison by that analysis of the period of this new crisis intervention services going home to the people in need of help, instead of the, as it was 80s still, that they came into the hospital. And then we realized that there seems to be a kind of illustrative guidelines of optimal treatment in the new system, and that was the time we started to name that as an open dialogue. We thought that what is the name of this system that could be illustrated of this open dialogue. And this word dialogue actually refers, of course, partly of the dialogues that we have with the clients in the meetings, but only partly, because there are also some other important elements that illustrate the entire system working into the direction that makes the dialogues optimal, that makes possible to have the dialogues in the way that there's optimal use of them for the family and for the system. And then we came on these 7 main principles, which is that it's most optimal that the treatment start immediately in a crisis within 24 hours, which means that we have to organize our system to make it possible. The second idea was that always include the nearest, those closest for the patient to be involved in the first meeting if needed, or the 6 subsequent meetings for as long time as needed. We named this as a social network perspective, always to have always start the treatment by having the context of the social life, of the social context of our clients. And also one part of this was including other professionals who has been involved in this idea. The third point was this flexibility in using different methods and integrating different methods of treatment, for instance psychotherapy, or integrating medication as a part in some cases. Some can need for being in the hospital for some days and so on. Always with the thought that every response should be adapted to the unique needs of every client and his or her family. Instead of thinking that when we know the diagnosis, we know the treatment. That's not the case, but always come to an idea that what is the best way to do it. And very important idea here, what people don't recognize often, is that we use all the methods of treatment. People can use a lot of work with occupational therapists. Some can take use of individual psychotherapy that can be run by psychodynamic ideas, or someone are used to work in more cognitive behavioral way, and so on and so on. Every methods can be used in this joint process. The third and the fourth principle concerns or consists of this idea of being available for the clients. So being available in the way that we guarantee always we take the responsibility when whoever contact and whenever. Who is contacted in the system has the responsibility for organizing first meeting. And then in the meeting it is decided who are the ones who are best to take charge of this system. If it is a mother calling, for instance, psychiatric hospital, for instance, to me as a psychologist describing of her son. So I started to think while she was speaking of that her son has also been drinking quite a lot. Perhaps this has something to do with too much drinking, that he has started to behave in an odd way that led me think that perhaps he has some psychotic ideas. But I don't say, I was no longer allowed to say to the mother that this belongs not to us, you please take contacts to the abuse clinic. But what we learned to say was that it's good that you make this contact, now we can come together and discuss while I listen to you. So I start to think that perhaps this problem may have something to do with the too much drinking. Would it be okay for you if we invite someone from the abuse clinic, alcohol abuse clinic, to come with us into the meeting? And in that way we integrate the different parties. And this concerns also the idea of guaranteeing the psychological continuity, which is very important, going across the boundaries of different services so that we can really integrate teams. Someone comes thereafter from the alcohol abuse clinic and some other ones from the mental health outpatient clinic, and they form the team together, perhaps with the doctor who can be a kind of consultant in the process throughout the case. And then the last point of these principles are that we aim at having safety for the family who is in crisis, meeting as often as possible to guarantee that they are not left alone, and also that there is a quality in the meetings, that everyone becomes heard. It's a challenge in crisis because there is such a big contradiction. The one who is suspected using drugs, young man, he has all different understanding of the problem that parents. But when we work in a team, someone can listen to the son and some other ones to the parents. Treatment decisions are always done in this open forum so that the client and the family members, they always can follow. Of course, they don't only follow, they are active participants in making the plans. And all the discussion concerning what is the background of the ideas of having this and that treatment method is also discussed openly. Everything is transparent in that respect. What is very empowering experience for the families also.
And not disempowering for anyone.
Yeah.
I guess one of the things that happens in my service a lot is that people are brought by the police.
Yeah.
And often the police want the person to be locked up.
Yeah.
And I'm wondering how the open dialogue system would respond to that sort of situation.
Well, we have the meeting. I'm sitting in a meeting in which someone can come with a handcuff by the police. And the meeting starts. In the beginning they are usually very agitated, but if we have an optimal meeting they can be sit silently and discuss without this agitation in the end. So they are very important points to have the meeting exactly at that point of time.
So can I clarify what you mean? Do you mean that if the police bring something, you will have an open dialogue meeting with the person and the police, the person in handcuffs to start with?
Yeah.
And then
In Western Lapland, police are very motivated to be in the meetings.
Okay.
And I also suppose that staff very much like to have police in the meeting, because in some cases that can be the case. Some other cases, of course, it's only occasionally that the police is there, and it doesn't have any bigger role than that.
And I remember when I visited Karaputas Hospital, the people in the hospital acute ward seemed to be people with drug-related problems as opposed to people who had been in a psychotic relapse.
Yeah.
I guess the data says you don't have many psychotic relapses from patients, but with people who are intoxicated and we have a lot of amphetamines in Australia. So would you start the meetings when they're still intoxicated, or you wait some time?
I suppose that depends quite a lot of what is the situation, but being under the influence of drugs should not be a kind of a kind of general kind not to have the meeting. They may emerge situation in which you need to have the meeting immediately, but of course there also may emerge situation in which you are so heavily intoxicated that it's good to wait, for instance, 1 day before we have the meeting, but not to postpone all too long time ahead. This is something that I'm not so. I know that this drug abuse and drug-based psychotic problems have become much more popular nowadays compared to the time that I was working there 15 years ago. And people in Keropolis definitely had much more to say of these issues than I.
Okay.
know.
Well, thank you very much.
My pleasure.
And I hope we can see you in Australia soon.
Yeah,
Thank
I
you.
would be delighted to be there.